स्क्रीनशॉट लेना आता है दीदी आपको लैपटॉप में? हाँ? मुझे पता है, वो सास से पूछ रही थी।
So good evening, everyone.
Good evening, sir.
Good evening, sir. Good evening, sir. Yeah, good evening. Okay, so I hope everyone is connected. Okay. So today we have to discuss the important topic modifier, guys. Right. So today we have to discuss modifier. So I'm already informed. Without modifier, we are not able to give any answers for any surgery coding assessment, right? So that's the reason this modifier is very important. So today we have to discuss, and one more thing, guys. I hope you guys already know the modifier we already have in your CPT book, the first page, right? The first page you guys already have. Just whatever the modifier we discuss, you guys try to understand. Okay, for this scenario we are using this modifier. That is enough, because the modifier when you guys will learn mean whenever you guys are getting attend more questions, practice question, like whenever you have to attend the assessment, that time only you guys will understand, okay, how to use the modifier and everything you guys will know, right? Okay, so please note down, guys, the heading is modifier. The heading is modifier. So the modifier we already discussed in anesthesia, but whatever the modifier we are discussing in anesthesia, that one we have to follow only in the anesthesia coding. So we are not using in other series. So today, the other series like surgery and then radiology, what are the modifier we are using, we are discussing one by one. And the main two function, please note down, guys, we already discussed, but again I have to discuss. The modifier we are using for two major purpose. One is the modifier we are using for two major purpose. One is the modifier prevent rejection from insurance company. The modifier prevent rejection from insurance company. And next one, modifier is used for additional payment. The modifier is used for additional payment. So this is the two function, guys, we already discussed. Because of modifier, we are receiving, the product receiving additional payment. At the same time, the modifier helpful for rejection from insurance company. So this is the two main function, right? Okay, we discuss one by one. So the first thing, we have the E&M modifier. Guys, E&M modifier now we are not discussing, because you guys don't know what is E&M on how to do everything. So whenever we are discussing E&M topic, that time we will discuss this E&M modifier. So leave that, guys. The next, you guys please note down the surgery modifier, guys. The next one, you guys please note down surgery modifier. Surgery modifier. In this surgery modifier, we will discuss one by one. And one more thing, guys, in your CPT book, you guys having lot of modifiers, right? So you guys having more than 50 to 60 modifier. But one thing remember, all the modifier is not important. You guys clear? We have a lot of modifier, but all the modifier we are not using also. So very few modifier is important. Maximum in your exam point, if you guys prepared 10 modifier, you guys clear? In your exam point, if you guys prepare 10 modifier, that is enough. So the 10 modifier is very important for your exam. Clear? Okay. So please note down, guys, the first modifier is modifier 22, guys. The first one is modifier 22. This is increasing procedural service. This is increasing procedural service. Okay. So please note down, guys. Please note down. In your documentation, in your documentation, if MD if MD in your documentation, if MD mention if MD mention if MD mention additional timing, additional timing, additional timing or extensive term, right? If the provider documented additional timing or or the provider documented additional timing or extensive term, we are using the modifier 22, guys. We are using the modifier 22. Right? Okay. So that's all, guys. So very simple. Sometimes in your exam question, guys, mainly I will give you the hint. So in this question, which topic we are discussing mean mainly in your chapter 4, right? So in your chapter 4, we are receiving in this particular question. Sometime in your question, the provider documented, I am performing additional few minutes to do this procedure, or else I am spending additional this much hours to do this procedure. Like that, the additional timing the provider will mention. So in your question, if additional timing is documented, you have to use 22 modifier, or else sometimes the provider mention, I am performing extensive procedure. For example, I am performing extensive appendectomy. I am performing extensive cholecystectomy, like that. So in these type of question anything they documented, that time we have to use the code modifier 22. One is additional timing, another one is extensive. I am performing extensive appendectomy, I am performing extensive cholecystectomy. Like that, the extensive term, anything they mention, that time you have to code modifier 22. That's all, guys. Clear? This is for 22 modifier. This is for 22 modifier. And the next one is modifier 50, guys. The next one is modifier 50. So 50 mean, please note down, it's a bilateral procedure, guys. Right? So the modifier 50 mean bilateral procedure. So bilateral procedure mean so we know, right? It is very frequent modifier, guys. If the provider documented, I am performing bilateral procedure. For example, I am performing bilateral nephrectomy, like that. Any procedure, the provider documented bilateral term, that time we are using the modifier 50, right? But one thing, don't forget, guys, many of the candidates, they don't know these two guidelines. So please note down, whenever you have to use modifier 50, that time you have to check two important guidelines you have to follow. Right? Please note down, guys, the first guideline is if CPT code description already have bilateral term, if CPT code description already have bilateral description, we don't code 50 modifier. You guys clear? We don't code 50 modifier. Guys, again I repeat, you check one CPT code. In that CPT code, already bilateral term is given. That time we don't use 50 modifier. This is one. I will show you the example. You guys, no need to worry. I will show you the example. And the second guideline is if plural term is documented, we don't use 50 modifier. Singular, plural, you guys know, right? Plural term. If plural term is documented, we are not using 50 modifier. These two guidelines, don't forget. Right? Okay. So you guys see the screen. I will show you the example. You guys see the code 58600. In this code description, already bilateral is there. So this scenario only I said, guys, if already the CPT code, the bilateral term is there, we don't use 50 modifier. And the second guideline, plural term. You guys see fallopian tubes. So you guys clear, right? Tube mean singular. Tubes mean plural. If any code description already plural term is documented, that one also we are not using 50 modifier. That's all. Okay, you guys tell me the answer. Wait. Okay, you guys tell me, can we use 50 modifier along with 58670 code, guys? Anyone?
No, sir.
No.
No. Why we are not using?
So there is already mentioned plural like oviducts.
Yes. So they given OV ducts. So we don't use 50 modifier, guys. Right? Okay. So next one, okay, can we use 50 modifier along with 58661? Can we use 50 modifier along with 58661? Anyone? Can we use or we don't use? Guys? So we are not using 50 modifier because they given adnexal structures. So we don't use. You guys clear? What I am telling? Everyone is clear, guys? Guys, this is very important.
Yes,
If
sir.
single letter, if you guys did not give the importance, we are getting error in exam. So if any question, if bilateral term or if the provider documented plural. So if anything you guys are documented like this, don't use 50 modifier. Otherwise, any scenario we are using if documentation supported me. Right? Okay, last question. Can we use 50 modifier along with 58672 code, guys?
Yes, sir.
Yes. So we
Yes,
have
sir.
to use because we don't have any documentation for bilateral or plural term. That's all, guys. This is the two guidelines,
Okay.
right? That's all. So this is the modifier 50. The next one, please note down the modifier 51, guys. Modifier 51. This is multiple procedure. Modifier 51. Multiple procedure. And then you guys please note down modifier 59 also. 51, 59. Please note down both. The next one, please note down modifier 59. So 59 is distinct procedure. Clear? Okay. So why these two modifier I'm discussing together, right? 51 and 59. Why we are discussing together mean, guys, please concentrate. If more than one procedure the provider doing together, right? So in your documentation, if more than one procedure, like 2 or 3, whatever, the more than one procedure, if the provider is documented, either 51 or 59, compulsory we need to use, guys. Either 51 or 59 we have to use. But we have small changes in this modifier, right? So please note down 51 modifier mean single incision, multiple procedure perform. Single incision, multiple procedure is performed. We have to use the modifier 51, guys. Single incision, multiple procedure perform mean you have to use the modifier 51. For example, one patient having lesion in the hand. So the provider what they are doing mean they have to make one incision in hand. First they remove the lesion. Next they are doing the repair. Now single incision only they made, but two procedure they perform. In this scenario you have to use the modifier 51. You guys clear? 51. In case in your question if the provider documented more than one incision is they documented, right? More than one incision if provider is documented, that time you have to use 59 modifier, right? If in case they documented 2 incision or 3 incision like that, anything they document, that time you have to use 59 modifier. For example, one patient having fracture in hand and then kidney stone. So for example, the provider fracture they made one incision and they are doing the procedure, and then kidney they made incision and they remove the stone. So this scenario we are using 59 modifier. That's all, guys. Now I'm just to explain. Okay, this is a scenario like that. But whenever you have to attend the assessment, that time you guys are getting lot of different scenario. So all those scenario, whenever you guys are practicing, then automatically this type of modifier concept you guys will getting in your concept. That's all. It's a very simple thing, right? So still now 4 modifier we have discussed: 22, 50, 51, and then 59. Guys, this 4 modifier, you guys, everyone is clear? Can I go with next modifier?
Okay.
Right? Okay. So next 2 modifier is, you guys please note down the modifier 52 and 53. Modifier 52 and 53. The modifier 52 and 53. Okay. So in these 2 modifier, what is the main advantage mean? You guys please note down, if any procedure is cancelled, right? If any procedure is cancelled, either you have to use 52 or 53 modifier. Guys clear? If any procedure is cancelled, either 52 or 53 modifier you have to use. Okay. So now I will give you the description, guys. Please note down 52 when we are using mean the procedure is cancelled due to MD decision. The procedure is due to MD decision. The procedure is due to MD decision. That time we have to use the modifier 52. and then 53 mean, the procedure is cancelled due to patient complication. The procedure is cancelled due to patient complication. So this is the difference, guys. For example, 52 modifier. Sometimes the patient is ready for procedure. The provider also is starting the procedure. Sometimes suddenly the scope is not working. Or else sometime what happen mean the provider having machinery problem. So any scenario, because of any scenario, the provider cancel the procedure. The provider planning and they have to cancel the procedure. Now we are using the modifier 52. If procedure is cancelled due to MD decision mean we are using the modifier 52. And 53 mean the procedure is cancelled due to patient complication. For example, the patient suddenly getting bleeding or the patient getting shocked. So any of the situation because of patient the procedure is cancelled. That time you have to use the modifier 53. That's all the difference, guys. This is the difference between these two particular code sets. Guys, clear? That's all. So 52 mean the procedure cancelled due to MD decision. 53 mean the procedure is cancelled due to patient complication. Okay. So still now 6 modifier we are discussing, guys. All the 6 modifier is very important for your exam as well as in your coding. So 22, 50, 51, 59 and 52, 53. Clear? Okay. So next 3 modifier, please don't note down, guys. The 54, 55, 56, we are not using this modifier. So in coding as well as in exam, we are not using this modifier. Actually, if I want to delete mean the entire PPT will collapse. That's why I'm not removing this actually. So what does this modifier mean? Some of the provider, they are doing only the surgical care alone. Some provider, they are doing only post-operative management, and some provider, they are doing only the pre-operative management. So based on the provider, we have to use this, but you guys no need to note down. It's not important for your exam. Okay. The next one, please note down the modifier 58, guys. Please note down. Modifier 58. Guys, what is post-operative?
After surgery.
Yes, it's a after surgery, right? Okay. So actually one more thing, guys, in your CPT book, we have three post-operative modifier, right? 58, 78 and 79. This modifier, you guys just understand the concept, which mean when we are using this modifier, that is enough. But in your exam, we are not receiving this modifier because if the post-operative modifier we need to build mean, we need the patient previous surgery details like when the patient come and which provider perform and which date, what is the specialty, all the details. Whenever these details will given, then only we are able to code this modifier. So in exam it is very rare, but in your coding, right? So if you guys are enter into coding, that time this modifier we are using very frequently. Okay, so the first one is modifier 58, guys. Modifier 58. So what does this modifier 58 mean? It's a staged procedure. It's a staged procedure. For example, The patient, just scenario wise I will update guys. For example, the patient today coming for leg wound. So the provider what they are doing mean they have to clean the wound and then they are doing the dressing. Then the provider informed to the patient after 10 days again you have to come and you are doing the dressing change. Like that the provider given the instruction. Same likewise the provider, as per the provider guidance, after 10 days the patient come and they are doing the dressing change. Now we are using the modifier 58 guys. That's all. Clear? So if any procedure plan as per the plan in post-operative period it is happening mean we are using the modifier 58. That's all. But 58 is a optional, right? The next one is a 59. We already discussed. Then 62 and 63, please note down guys. This is for two surgeon. This is for two surgeon. So 62 is for two surgeon. So two surgeon mean you guys know. So some of the provider, for example, if any complicated procedure, anything, for example, 10 hours, 12 hours procedure. So single provider they are not able to do. So sometime the two surgeon will be split the procedure and they are doing. So if any of your question, two surgeon performing procedure like that they mention, that time we are using the code 62 modifier we are using. This is for two surgeon. And the next one is for 63 modifier. This is the infant modifier guys. This is for infant modifier. So if any procedure the provider performed to newborn infant, that time we are using the modifier 63. So in this slide 59 only important guys. Remaining all the modifier is just for your knowledge. Clear? Okay. The next guys, please note down this slide and update me. After completing this slide, please update me. Once you guys complete, please update me guys. Completed, sir. Okay.
Completed, sir.
Okay.
Completed, sir.
Okay, guys. So I hope you guys are completed. Okay. So here we have totally five modifier I'm mentioning. So one by one we have to discuss. The first one, 76 and 77 modifier. So this is for repeat procedure by same physician, and 77 this is for repeat procedure by different physician. That's all. Actually, this is the provider oriented modifier, guys. Right? This is the provider oriented modifier. Overall, whatever the modifier, comparing to all, this two modifier only, you have to code based on the provider. So very simple. When we are using 76 mean, the same procedure, the same physician, if they are doing mean, we are using 76. For example, the A-line procedure, morning, the William provider will perform. Then again, evening, the same William provider, again they are doing the A-line. So now we are using the modifier 76. And then 77 mean repeat procedure by other physician. For example, morning William perform, and then evening the James will perform. So it's the other physician. Now we are using the modifier 77. That's all the difference. So same physician or different physician. So this is the two thing, right? Okay. So this two modifier also optional for your exam, guys. Right? This is not very important. Optional for your exam. And the next one, 78, 79 modifier. Guys, after completing this all the modifier, I will tell you, right, in your exam point, what all the modifier is very important, right? So I will discuss what all the modifier is very important. I will discuss. Okay. So the next one is the 78, 79 modifier. Guys, this modifier is very important for your coding. Maybe in future, if you go with surgery coding mean, this modifier is very important, right? Okay. So the modifier 78. So if you guys read the description, we are getting the answer. So unplanned return to operation room because of initial procedure. I will tell you with scenario. Actually, this scenario very frequently happen. For example, one patient, the patient having CAD, right? The patient having CAD. So the provider, what they are doing mean, they are doing right. So the provider performing the CABG procedure, right? The provider perform CABG procedure. So the procedure is done. So the procedure is completed. So after that, the patient leave from the hospital. So they are discharging. After 10 days, suddenly in that surgical area, in chest, the provider performs CABG, right? In that surgical area, the patient getting infection. So the patient coming to hospital for infection. Now we are using the modifier 78. If any procedure, because of that, if the patient getting some complication, post-operative complication, that time we are using the modifier 78, guys. You guys clear? Okay, now you guys tell me 79 modifier, which scenario we are using? Anyone? 79 modifier, which scenario we are using, guys?
Sir, unrelated services.
Um,
Okay, so in this scenario, for example, the same patient, you guys just imagine the same patient, the patient CABG is completed, then the patient leave from the hospital. After few days, the patient get fracture. It's not happening, just for your understanding, I will tell you guys. So the patient getting fracture. Now the patient coming to hospital for treatment. So now you are using the modifier 79, unrelated procedure. Previously CABG, now coming for fracture. So in this scenario, we are using 79 modifier. Clear? 78 mean because of previous surgery, the product getting some complication. 79 mean first time different procedure. Now different procedure the product perform. Now it is comes under 79. But this two modifier is very important for your surgery coding, guys. Right? And the last one is the 80 modifier, guys. 80 modifier mean it's a assistant surgeon. Right? So the last one is a assistant surgeon. Okay. So you guys tell me, two surgeon, assistant surgeon. This is same or different, guys? Anyone?
different.
Yes, it is different, guys. Because two surgeon mean the two surgeon they are doing same work. But assistant surgeon mean the second surgeon just assist. That's all. This is the difference between these two. So in case any question, assistant surgeon involvement, if the product is documented, that time we have to use the modifier 80, guys. Clear? That's all. So that's all. Okay. Then the last modifier, the last one is 26 TC and 91 modifier. Please note down, guys. Twenty-six TC and 91 modifier. So please put important symbol on 26 and TC modifier, guys.
Completed, sir.
Completed, sir.
Okay, guys. So, you guys, please note down the 26 TC is for, we are using for radiological modifier. So, in these two modifier, so very important, right? Okay. So, please note down, guys. Okay. First, I want to discuss, if you go with any hospital, 98 percentage all the hospital having own radiological department. Is it right? If you go with any hospital, so 98 percentage of hospital having own radiological department. So very simple, guys. If the radiological service performing in hospital mean you are using the modifier 26. If the radiological service performed in hospital mean you are using the modifier 26. If the radiological service performed in other than hospital, like office or clinic like that, other than hospital, if they are performing mean, you have to use the modifier TC. That's all the different, guys. If the radiological modifier, sorry, the radiological service performed in hospital mean 26. If the radiological procedure performing in other than hospital mean, you have to use the modifier TC. That's all the different, guys. But the 26 modifier very frequently we are using, right? And then the last modifier 91, this is for repeated lab test. So please note down, this modifier we are using in chapter 8, guys. Chapter 8 mean lab and path. Chapter 8 mean lab and path. So for example, any lab test the provider repeatedly they are doing mean, we are using the modifier 91. For example, the patient having dengue. So what happened? Every 2 hours once the provider doing the platelet count, right? So that time we are using 91 modifier. So this is for 91. And one more important modifier, please note down, guys. Recent days we are receiving this modifier. This is modifier QW, guys. So please note down modifier QW. So QW mean, you guys please note down, CLIA modifier. CLIA. CLIA modifier. CLIA. CLIA modifier. Right? So actually CLIA mean one certificate, guys. CLIA mean one certificate. So whenever the COVID will become, that time this QW modifier newly added, guys. So that's the reason in exam frequently receiving this modifier. Very simple. If any question, if the product documented what, for which scenario we are using QW, if they are question asking like this mean, your answer is CLIA. CLIA mean on certificate, guys. The abbreviation is no need. If you guys want mean after this session, you guys just check in Google also. It's a lengthy one. But if any option CLIA is documented, you have to code it as QW. That's all. That's all about modifier, guys. So now I will tell you the important modifier, guys. If you guys prepare these modifier alone, that is enough for your exam. So what does that mean? The first 6 modifier, you guys please put important symbol. The 22, 50, 51, 59, and then 52, 53. These 6 modifier is very important. Then last 4 modifier. last 4 modifier. What does that mean? 26 TC and then 91 and QW. So if you guys are given importance to these 10 modifier, that is enough for your exam. So remaining all the modifier is just for your knowledge purpose. You guys clear? That's all about modifier, guys. That's all. But these are all the modifier you no need to mug up because we already have in your CPT book first page. Whenever you have to attend, you just to go and check that page and you have to code accordingly. But after getting more practice only, you guys know about this modifier usage, everything. Clear? That's all, guys. So in this week, I have to share chapter 4 assessment. You guys please start that. And tomorrow we start chapter 5. Right? It's a urinary and male and female reproductive system. So tomorrow we have to start the new topic, guys. That's all. So thank you, everyone. See you on tomorrow, guys. Bye, everyone.
Thank you, sir.
Thank you, guys. Thank you, everyone.